Hello everyone, my name is Xavier Gonzalez and I will be presenting on behalf of my group 4, which also included Carla, Halima, Mohammed, and Alua Famike. Our group focused on creating a COVID-19 response proposal for the state of Texas, which I will be presenting to you today. So here's our agenda. First, I will be giving you an overview of COVID-19 in Texas. I will explain some of the epidemiology of COVID in the state, the strengths and weaknesses of leadership response and interventions, and how they can go about improving their response to protect the Texan population in the future. This will help segue directly into our proposal, where I will discuss various elements of improvement. So let's begin. Texas has been ravaged by the COVID-19 pandemic. It has seen 8,895,876 COVID-19 cases since the pandemic began. This year alone has seen 624,295 cases, and from November 5th to November 11th, there were 10,640 new cases. This amounts to a case rate of 34.12 cases per 100,000 people. For context and perspective, in the first month of the 23-24 flu season, there have only been 1,869 lab-confirmed flu cases, which equates to a case rate of only 5.99 cases per 100,000 people. In terms of fatalities, the state of Texas has seen 93,377 confirmed deaths. In 23, deaths amounted to 2,716, and the last week reported deaths amounted to 40. Case fatality rates for the disease were calculated to be 1.05% since the beginning of the pandemic and 0.44% in 2023, which highlight our improvement in taking care of patients with the disease. These numbers show that while we have improved in taking care of patients with COVID, there is still much work to do as the disease continues to be significantly more infectious than similar respiratory viruses. There were many strengths in Texas public health response efforts for COVID-19. The Texas State Department of State Health Services, or DSHS, has collaborated with the CDC to monitor the outbreak and provide guidance to healthcare officials and the public. Outbreak control strategies and interventions have included contact tracing, testing, and immunization campaigns. Healthcare workers and public health officials collaborate to accommodate patients and address case surges. Many public health campaigns early in the pandemic focused on raising awareness about mask use, physical separation, and vaccination. However, while there were many strengths, there were also weaknesses in leadership response in Texas. For example, lawmakers have consistently failed to advocate for vaccines and they often provide misinformation, which has resulted in a significant portion of the population remaining skeptical, while also endangering the well-being of vulnerable populations such as the elderly. Texas lawmakers also introduced bills that limited local authorities' ability to implement vaccine mandates. Republican lawmakers in particular have prioritized political considerations over pandemic public health issues. This has undermined efforts to protect the public. Lawmakers have also failed to allocate enough resources throughout the pandemic. Some ideas to improve leadership response to COVID-19 and other pandemics are the following. Leaders need to use technology to disseminate information. They should also collaborate with community leadership to develop culturally sensitive messaging campaigns. They should prioritize accessibility and availability of COVID-19 testing and vaccination services. Leaders need to conduct regular meetings to keep the public constantly aware of COVID-19. Overall, they need to prioritize the constituents' health over political gain. Some of these suggestions are part of our primary proposal, which I will now introduce. First, our proposal's mission is to protect lives, empower the health system, and promote the well-being of Texans. And our vision is to advance innovative solutions that promote access to quality health services for Texans. In terms of innovation, Texans need to focus on improving the use of technology through mobile apps, telehealth platforms, and wearable devices that can help monitor health and disease trends, track patient progress, and deliver health information. We need to make disease education simple and easy to access through online resources for the public and students. Finally, we should engage with the community by mobilizing nonprofits, healthcare clinics, and grassroots organizations to ensure that vulnerable populations can access information, testing, and vaccination resources. Our technical package includes 5 key components, which are detailed below. Surveillance needs to involve tracking of variants of concern through lab testing facilities because the disease is constantly evolving. Contact tracing will allow us to limit the spread of future outbreaks. Importantly, we need to collect data on COVID-19's effects in different demographics and transparently disseminate that data to key stakeholders. Medical facilities need to have adequate supplies of PPE, medical equipment, medications, and vaccines. We need to continue to protect vulnerable populations such as the elderly through vaccination campaigns. Public health agencies need to create up-to-date standards of care guidelines and communicate them with all medical facilities. Guidelines should include processes and procedures to follow and treatment methods for patients of different acuity levels. Finally, there needs to be adequate staffing of public health workforce as has been shown to be an evidence-based approach to improving individual and community health according to Begga et al. In terms of performance management, to establish reliability of surveillance, we assess communication timelines between labs, the DSHS, and other stakeholders to ensure timely reactions to new outbreaks or highly contagious variants. Our approach examines the effectiveness of surveillance initiatives and pinpointing infections among marginalized groups. Our evaluation of contact tracing measures and integration to our other health interventions, timeliness, total number of contacts tested and isolated, and adaptability. We hope to educate the public about vaccines through educational campaigns. Measuring the number of vaccines before and after our educational campaign will show if it successfully increases vaccine numbers. Lastly, our social media intervention will be evaluated by the number of accounts reached, information accuracy, and account interactions. The table on the right depicts what we seek to answer through data metrics for our outreach interventions. Our proposal is to build partnership with three key purposes in mind: educating the public, providing equitable healthcare access to marginalized communities, and implementing technology solutions to bridge gaps. Our education partner organizations are the DSHS and the Texas Statewide Health Coordinating Council, or the SHCC. The DSHS partnership aims to utilize aggregated surveillance data for tracking outcomes and supporting communities. The SHCC, an initiative by the DSHS, focuses on health promotion through prevention and education. These partnerships enable the implementation of education strategies in local communities and real-time adaptation to changes in the COVID-19 landscape, allowing for the effective communication of new variants to the public. The Texas Telehealth Resource Center serves as our solutions partner, focusing on promoting telemedicine in Texas. Guided by the ECHO framework, this center employs innovative telementoring techniques to reduce disparities in underserved regions. The partnership aims to integrate COVID-19 center strategies targeting vulnerable populations and reducing infection spread. Finally, our equitable healthcare partner is the South Texas Area Health Education Centers, which focuses on assisting health profession students' readiness for the roles in primary care, emphasizing their preparedness to serve in rural underserved communities. This partnership will allow us to directly impact COVID protocol with updated best practices centering on marginalized communities and providing a unique opportunity to shape new professionals on COVID protocols as the virus evolves. Our communication is split into general communication guidelines, communication with vulnerable communities, and communication with politicians. Our general communication guidelines starts with updating our public health central information hub, which should provide historical and current updates on COVID-19. While political and public health leaders need to have continuous communication with the public, messages should be simple and sensitive to political beliefs and views. In the long term, scientific literacy of the public needs to be developed through enculturation and education. We also need to take advantage of influencers and social media savvy experts to help deliver simplified messages and improve trust. All communication should be performed on various channels. Any misinformation should be promptly corrected with transparent messaging. We need to follow the public and other stakeholders we need to allow the public and other stakeholders to provide feedback and other questions. Finally, we should also communicate with local leaders and partners to facilitate coordination, planning, and response efforts. When communicating with vulnerable populations such as African Americans and Latinos, we must leverage key individuals and leaders in the communities, as they tend to have significant influence over these groups. For example, when trying to reach African American communities and disseminate information to them, Black clinicians and pastors considered trusted messengers can help to reach more people, according to Dada et al. Within Latin American communities, priests and Spanish-speaking clinicians can make propagating information more effective and efficient. Reaching these groups is important to maintaining health equity in the state, and that is especially true for Latino Americans, which have become the largest demographic in Texas, according to the U.S. Census Bureau. Keeping this fact in mind, we have included an amazing table adapted from J. Demeke et al.'s Strategies that Promote Equity in COVID-19 Vaccine Uptake for Latinx Communities, a review, which outlines partnership strategies for building trusted communications and access around COVID-19 vaccines among Latinx communities at both the state and county levels, utilizing a variety of mechanisms to easily disseminate information in different locations to improve vaccine access. Finally, communicating with policymakers requires its own nuance. When speaking to politicians themselves, we must present both sides of any arguments to show empathy for their constituents. Doing this requires providing a cost-benefit analysis for any proposals. Further, we need to disclose any conflicts of interest to build trust with politicians. Politicians must also be approached at the right time, which involves knowing legislative session schedules, as approaching them during a session break, no matter how relevant a proposal may be to a developing situation such as an outbreak, will ensure that the proposal never gets accepted. Lastly, both sides of the aisle, Republicans and Democrats, should be spoken to in order to bridge gaps and create bipartisan ideas. The final section of our proposal seeks political commitment and partnerships. To do this, we must take into account that Texas has experienced many leaders with differing views and personalities which have contributed to the state's unique political dynamics. Our proposal seeks to advocate for nursing care workers in Texas by suggesting legislation that addresses several worker protection issues, particularly that of staffing. Senator Colhurst is a perfect person to carry out our mission of safeguarding Texas nursing home employees through her role as the chair of the Senate Health and Human Services Committee. Her role requires her to institute public health policies and supervise doctors and other licensed experts. In addition to Senator Colhurst, the mayor of Houston, Sylvester Turner, could be a valuable local political partner. His response has been marked by protective measures with clear communication and a commitment to prioritizing public health. During the pandemic, Houston has actively established testing centers, increased hospital capacity, and provided resources to the most vulnerable communities. Mayor Turner often relied on the expertise of local health officials and scientists while making crucial decisions. Furthermore, he has lobbied for federal and COVID and state resources to support Houston's COVID response. The Texas Healthcare Association is another ideal partner for union satisfaction. Positive union culture can be fostered, and staff morale and union satisfaction can be improved by implementing fair employee wages, recognition programs, and incentives. This nonprofit organization is dedicated to providing resources, advocacy on fair wages, and education to improve the quality of care in long-term care facilities. They will be valuable advocating and lobbying for nursing home employees and their employees' safety and rights. Thank you for listening and have a great day.